Mayo. The question is that this bill be now read a second time. I call the honourable member for Stirling.
Thank you, Mr Deputy Speaker. As a Defence veteran myself, I am extremely pleased to speak today in favour of this bill, which will simplify the medical treatment for veterans. In fact, my wife is also a former Australian Army officer, and we've both previously been through laborious, time-consuming and costly processes of seeking medical treatment and then subsequently applying for reimbursement, which can take quite some lengthy period of time. However, this is a government which strives for continuous improvement. Whether those improvements involve lowering taxes, helping more Australians into jobs, stopping abuse of workers' entitlements by unions, or, in this case, helping veterans to access medical treatment more simply. I was personally briefed, as were some of my colleagues, just a week ago by the Secretary of the Department of Veterans Affairs, Liz Cosson, on the important improvements being made by the department. I've also been witness to the passion and the tireless efforts being applied by both the Prime Minister and the Minister for Veterans and Defence Personnel in achieving better outcomes in support of our veterans. The Department of Veterans Affairs, or DVA, is changing the way that it operates to make processes faster and easier for veterans and their families to gain access to the support that they need. In some cases, this requires changes to legislation which is administered by the department. The changes to legislation administered by DVA are not designed to remove any entitlements or lower the benefits for clients, but simply to simplify treatment arrangements. This government has listened. This government is continuing to listen to the concerns of veterans, to the concerns of their families and the ex-serving community to ensure that their needs are put first. For example, early in this term of government, myself, along with other new veterans and other veterans who are now serving as members of parliament, were invited by the Prime Minister. And the Prime Minister also invited the Minister for Defence and Veterans, the Minister for Veterans and Defence Personnel, the Minister for Defence, the head of the Department of Veterans Affairs. He invited the Chief of the Australian Defence Force and other heads of agencies to a workshop, and that workshop went for 4 hours. Now, there were times, because it was obviously here in Canberra on a standard working day, there were times when we got interrupted. There were divisions called and we needed to move in here into the House of Representatives, and then we went and resumed our work. And the Prime Minister was very keen on asking all of us a very simple and a very important question. The Prime Minister posed the question, what more can we do to better support our veterans? Well, there were a lot of fantastic ideas. First and foremost was a lot of the reforms which the Department of Veterans Affairs is already well underway with. This is called the veteran-centric reform and is taking a lot of the learnings from some of the inquiries that have been done in this place and the other place into the operations of the Department of Veterans Affairs, and has identified some really important areas for improvement. And that's where, as I mentioned earlier, the Secretary briefed us on the improvements already on the way. But this bill here is one important and very tangible part of the answer to that question that the PM posed to us: how can we better support our veterans? Currently, about 4,000 veterans under the Military Rehabilitation and Compensation Act of 2004 have to seek reimbursement from DVA for the costs associated with their treatment. Once this legislation has passed, these veterans can use a DVA healthcare card to gain access to treatment for accepted conditions. The new arrangements will mean all eligible MRCA veterans, like other DVA clients, will have access to a DVA health card or white card. These veterans can then present their card to the healthcare provider for payment by DVA through the Medicare system. Under these new arrangements, about 4,000 veterans will no longer have to pay upfront and then seek reimbursement from DVA. This will help ease financial pressure on veterans and their families. We heard recently that the partners, the spouses of veterans, whilst they're serving members, often struggle with employment arrangements. Now, there's a lot of movement between different geographies whilst a member is serving, and if their family is travelling with them, that often makes it very hard to bed down a new job. Even if you have a professional line of work that is easily transferable, it can't be guaranteed that in your new posting location there is work immediately available for you. So it has to be acknowledged that often there are financial pressures on defence families over and above those on the rest of the Australian workforce. But this provides veterans with an easier way to gain access to treatment, which is not compromised by their ability to afford treatment. Veterans will be better off gaining access to treatment through a health care card. These veterans will not have to pay for treatment and then seek reimbursement. This reduces financial pressure and red tape for veterans and their families. The change will also encourage veterans and their families to seek early treatment for their condition. We absolutely need to avoid the situation where a veteran delays medical treatment because they do not have sufficient personal funds to cover the initial cost before then being eligible to claim reimbursement from DVA. And that's a process which can take quite some time. And it adds to the pressure on families when they have to dip into their own pocket to seek medical treatment for a condition which related to their defence service and then wait for that reimbursement to occur. Defence salaries are fairly modest, especially if there is only one income provider for a family unit. And this is the case in many circumstances. After transition, the veteran may or may not yet be re-employed. There is certainly no guarantee that the veteran will have disposable funds to cover medical expenses. Often, X-rays, ultrasounds or MRIs even may be required, as well as specialist appointments, and these can be very expensive. I note that in the couple of years following initial separation from defence, there is an evidence-based situation where often people who have separated for defence take some time to find stable employment. So given those circumstances, it really highlights the need even further that this is a period in time when members have transitioned out of defence, and as a veteran that they need not to experience delays in having to pay for medical treatment. And when delay goes on, we know from our own experience if we ignore an injury, and that may just be a niggling injury at the start, it often gets progressively worse. If a veteran is in a circumstance where they haven't got sufficient funds immediately to go and seek that initial support, that initial medical treatment, well, that niggling injury could well turn into a chronic injury which could have been avoided. Let's consider here also the financial implications, where initial treatment for that niggling injury might have been quite inexpensive. If we leave that longer and longer, the medical treatment may well cost more. Mr. Speaker, this bill will provide veterans with a more timely and a more efficient method of accessing medical treatment, and I commend this bill to the House.
Thank the member for Stirling. The question is that this bill be now read a second time. I call the Honourable Minister.
Well, thank you, Deputy Speaker. In summing up, I'd like to thank all members who have contributed to the debate on this bill. and acknowledge the continued tradition of bipartisan support for the veteran community as demonstrated by both the opposition and the crossbench. I note that several of the speakers were veterans themselves. We just heard from the member for Stirling, but we also heard from the member for Eden-Monaro and the member for Herbert, and I want to say to them quite simply thank you for your service to our nation. Deputy Speaker, the Military Rehabilitation and Compensation Amendment Single Treatment Pathway Bill of 2019 is designed to provide veterans with a more timely, convenient and user-friendly method of accessing their medical treatment. And as the Minister for Veterans and Defence Personnel, I recognise the Australian community has a clear expectation that our veterans will be well looked after, and of course as a government we are absolutely committed to putting veterans and their families first. This bill will simplify access to medical treatment for veterans without the need for claim forms or reimbursing upfront costs via our Department of Veterans Affairs health card. Deputy Speaker, since the introduction of DVA health cards, uptake in treatment among veterans has improved, indicating that where they do not face any upfront costs, veterans are much more likely to access treatment for service-related injury or disease. Once this bill is passed, veterans will only need to present their DVA health card at the time of receiving medical treatment, and payments will be made directly to health providers via the Medicare system. Around 4,000 clients will no longer have to pay up front and then seek that reimbursement from DVA. Deputy Speaker, importantly, this bill retains discretionary power for the Military Rehabilitation and Compensation Commission to reimburse a person the cost of treatment or pay directly a health provider in special circumstances. These amendments will mean better outcomes for veterans, as they will have easier access to treatment as and when they need it. I commend this bill to the House.